if you treat a cold, it will go away in 1 week. If you don't treat a cold, it will go away in 7 days. If you have a job, you're comfortable in your job, it is time to get uncomfortable. I have had a reputation as a very, very tough boss.
I know it
I-
very well, Ambi. So you were my boss, but I also know that everyone wanted to work in your team.
Let the show begin.
Yeah, absolutely, Ambi. Hi, welcome to the very first episode of Complexity to Clarity, Pharma, Healthcare and More with me, Gauri Chaudhari. And today on this very first episode, we have distinguished guest, Mr. Ambi Parmeswaran. Ambi is a renowned advertising professional, leading brand strategist, CEO coach, and also the author of 11 bestsellers on the subject of branding, marketing, and advertising. Ambi has built several iconic brands like Tata Indica, Tata Indigo, ICICI, Santur, but very few of you may know that Ambi was also associated with some iconic pharma brands, some of them OTC, while others prescription. Here I must mention that I was fortunate to learn basics in brand building from Ambi at FCB Ulka. In fact, in my very first book, The Perfect Pill 10 Steps to Build a Strong Healthcare Brand, whatever I have written is inspired from that learning. So, thank you, Ambi. Thank you for everything. And thank you for being here on my very first podcast. So, thank you, Ambi.
Yeah, so thank you, Gauri, for inviting me to your uh, podcast series. Very happy to be here. Thank you for that warm introduction. I think it was a little too warm, so I may have to take off my jacket. But truth be told, a lot of these brands you spoke about uh, are brands which I was involved with. I will not say that I built them. I would say that I was in the team which built all these very iconic, very legendary brands. And of course, we've worked together in FCB Ulka. We've also worked on some really good campaigns for some really building some really memorable brands. So I'm very happy to be on your podcast and happy to discuss the topic which we have at hand. So thank you for inviting me. Let the show begin.
Yeah, absolutely, Ambi. Ambi, first and foremost, what always intrigued me that you're an engineer from IIT Madras, and I have seen a lot of non-pharma people or non-biology related people staying away from pharma industry. But for you, your one of the early career milestone was being with Boots, the pharma company, and building some of the iconic brands. I mean, being part of that entire journey. How did it happen? Was it very difficult to navigate through this pharma scene where tongue twisting molecules and very difficult mode of actions come in the way, or was it easy for you?
Well, I joined advertising after my IIM Calcutta MBA. So in a sense, I'd already kind of broken the mold because probably I was the first IIT, IIM to join an ad agency those days. I mean, those are the days, the late 70s was when ad agencies were recruiting MBAs. So they were recruiting MBAs from Ahmedabad, Calcutta, and Bangalore. But I was probably the only one who went there with an engineering degree. So already I was kind of thoda teda. And when I got called for an interview with Boots, Boots that time was a very, very prestigious company, and they used to pay their brand managers, product managers, we used to be called very well. So it was a very tempting offer. But the condition which my then boss, it was no more, Anil Kapoor said was, you will handle Coldarin and Bernal. You will also help out on Strepsils, but you have to handle ethical brands. So I said, look, what is an ethical brand? I didn't know what is an ethical brand. So he said, no, ethical brand is, pharmaceutical brand, which we promote to doctors. So I said, look, I have no idea. I have never done that before. in my advertising career for about 2.5 years, I worked on brands like, in fact, the opposite of health. I worked on red and white cigarettes and Thermax, boilers and cutout saris and caliber suitings and, Cadbury, Apella drink. So I said, look, I have no idea about pharma marketing. So he said, that's the whole idea. I want people who are not from pharma marketing to come into the company to provide new inputs. So, which is the reason why we're recruiting you. But I said, look, I don't understand all this. How are doctors? What are these products? What are their ingredients? My own memory of pharma was, my grandfather was a diabetic, and he used to get an insulin shot every day. The doctor used to come and give an insulin shot. And every other day, I was given the job of testing his urine, with that Benedict solution, and you show it in a flame and see if it is blue or green. So I used to do that once in a while. And that's all. I mean, I knew nothing else about pharma. So he said, no, you come. There are enough people to help you, and you will learn. And so in the beginning, it was like I had to do a lot of reading. I was handed over Brufen, and Brufen was a very, very important brand. So I would say right from the MD downwards, everyone was involved in the health of the brand. And Brufen 400 was being launched. And on Brufen, some landmark research had been done on consumers and on doctors. How do they prescribe? And based on that, we drew some conclusion. And I had to read up all the literature on Brufen. And then, of course, then I started reading, all your pharmacopoeia, Goodman and Gilman, and, Satoskar and Bandorkar, and some of those books one started reading to understand what this is all about. And I learned it. And I think within 3 to 6 months, I could talk with some confidence about pharmacology and pharmacotherapeutics. Though you should remember all the regional managers at Boots those days, we had 4 regional managers. They were all, giants in their own rights. All of them had risen the ranks, and they were all medical reps who become district managers, and then they become regional managers. And so in the beginning, it was difficult for them to even accept someone who's totally new to this pharma industry to come and tell them how to promote one of their most important brands. But I had the full support of Mr. L.M. Bai, who was the head of marketing, and the support of Anil Kapoor, the director of marketing. So with all their support, I managed to navigate those things. So it was an interesting experience. It took probably 3 to 6 months for me to understand. And then I used to go to the medical department, borrow books, read them, make, pull out quotations and all that stuff. So it was interesting experience. So I started making calls with doctors. I never been on a call. So I started doing active medical rep calls with doctors, going and meeting medical reps, talking to doctors. So it was a very interesting journey to move from one IIT IIM to advertising, and then from advertising to pharma marketing. So
Probably know you more as a person building ads for those brands which were seen on TV, but to know that you actually went down to doctors' cabins and explained Brufen to them and several other ethical brands, as we say. So I'll come to Brufen because that is one of the very landmark brands we have in the Indian pharma industry. But just going to Coldarin a bit, because that is one brand which was built on a very strong insight. And I'm going to show that ad to our audience because I'm sure there are quite a few Gen Zs and Gen Alphas who might not have seen it. So I'm showing this ad here.
ये क्या हाल बना रखा है?
कुछ लेते क्यों नहीं? कोल्डरिन ली?
कोल्डरिन के विशेष तत्वों से सर्दी से आराम, चुस्ती से चले काम. Coldarin.
And the basic questions that comes to my mind is how was that insight actually unearthed and how did you work on this brand?
Okay, so Coldarin was a brand I inherited. So in a sense, I read up on all the research was done on Coldarin. See, normally there is an old adage about the cold, which is, if you treat a cold, it will go away in 1 week. If you don't treat a cold, it will go away in 7 days. Right? So cold is there, cold will come and cold will go. No one has ever died of, cough and cold. But we still find it a problem. So the research which was done on Coldarin was done using, psychologists to find out what is the problem with cold? Why are consumers even bothered about treating a cold? And the insight which came was that cold is a minor ailment, but is a major botheration. So when you have a cold, you're not able to work. And the biggest problem is because of cold, it interrupts your work. You have a heavy head, you can't think properly, you can't work properly. So that led to the insight that there was a ad we had done about, why you're suffering from a cold, why don't you take a Coldarin? And with Coldarin, your work can go on smoothly. So sardi se aaram, chusti se chale kaam. Coldarin. That was the theme. So we only spoke about how cold interrupts work. Because of cold, you're sneezing, you're coughing, you're not able to work. You take Coldarin. So with Coldarin, chusti se aaram, you'll get relief very quickly. And sardi se aaram, chusti se chalega. So sardi se you get relief and you get chusti se chalega, calm will go on. So we did a whole series of ads. When I joined, they done an ad with a beaker falling down and breaking. After that, we took that and we said, we do a similar thing, but no, let us not do it in a chemical lab. In fact, the first ad showing the lab and the beaker breaking was shot in the Boots factory in Sion. The next one we did with some electronic components falling down. Okay, and then we did a multiple one, and you showed, I think one of those ads. So any good advertising, any good brand is based on an insight, right? And that insight has to come. Sometimes it can come from the product ingredient. Sometimes it can come from a competition, right? And sometimes it can very often comes from consumers. So in this case, the insight was that cold is a minor ailment, but a major botheration, and work interruption is a big problem with cold. Therefore, taking a Coldarin will give you symptomatic relief, and you will be able to then do your work properly. So this was the insight on which the whole campaign was built, and Coldarin continued pretty successfully. And you should remember, Coldarin competed with Richardson, Hindustan, now P&G's Vicks Action 500. For many years, Coldarin used to lead Vicks Action 500 in the game. So it was bigger. It was a bigger brand than Vicks Action 500. Though my good friend Bharat Patel of P&G claims that Coldarin was never as big as Action 500. I don't have the data, but I know for a fact it was bigger. It was bigger than Action 500. And mind you, Boots did not have a field force. We did not have a sales force. We only had medical reps. So our OTC products suffered because we did not have a sales rep going and calling on chemists and non-chemists. But Richardson, Hindustan, Richardson Vicks had those people, in spite of which we gave a tough fight.
Yeah, and it is very interesting to know that you actually had psychologists coming and telling what sufferings probably the consumer or the patient has. Ambi, sometimes I see that a lot of pharma prescription brands are supposed to be coming from patients' pain points, but rarely the marketing guys have a chance to really sit with patients. Is there any advice there? Do you think that is something too much to expect, or you think that is the must and one of the foundations of building any prescription brand?
So I think, if you look at any brand, FMCG brand, right? Brands are built on consumer insights. And to get consumer insights, you have to go and talk to consumers. You have to observe them. You have to understand what is their pain point. You have to understand why they're using a particular product or why they are not using a particular product. And in a sense, FMCG industry tends to over-index on that. They spend too tend to do a lot of this, trying to, kind of even look for some minor areas which they can blow up, right, and build into a mountain. The pharma industry does less of that. Pharma industry, of course, you have a lot of data. In fact, again, the young viewers here may not have an idea that the first retail panel in India was set up by a pharmaceutical company, right? It was set up by Sarabhai, and it was Vikram Sarabhai's idea. He set up a company called Operation Research Group, ORG, which did the first retail audit in the country. So in a sense, pharma industry in India was ahead of the FMCG industry as far as data and data analysis was concerned. But over the years, pharma industry tends to depend largely on retail panel, which is your IMS, or now it is what's called something else, right? Acquia data. Yeah, Acquia data. And you also depend on prescription audit data, right? So these are the two data points pharma industry uses. Pharma industry, I think, doesn't do enough of doctor research because of the feeling that anyway we are meeting the doctors every day, and doctors are telling us every day what they are seeing with their patients. So I don't think they spend enough time talking to doctors without their medical reps. And again, I don't think they do enough of patient immersion. And what you said, right? Patient journey mapping. What is the patient going through before they come to the doctor? And what are the symptoms they talk about? Very often, we are only looking at one end of the funnel. We are not looking at the other end of the funnel. So the patient might have come to the doctor. I remember for a particular brand, we were talking about balding, right? And so we are saying, let's go and talk to this brand is being prescribed by a dermatologist. But then the dermatologist said, look, by the time the patient comes to us, they've gone through so many things. So then they invested money to understand the patient journey. So what happens when a patient starts losing hair? What does he do? He talks to maybe his father, his aunt, his grandmother. Then he goes and talks to the neighborhood chemist. So by the time he comes to the dermatologist, he's probably put 16 different things on his head, right? And nothing has worked. So when he comes to the chemist, there is nothing the chemist can do but to tell him, look, get hair transplant done, right? So I don't think pharma industry is investing enough in looking for patient insights and also looking for doctor insights. Both are important.
Absolutely. And actually, today it has become a lot easier as well. Like you just do web scraping, you move on to several networking sites where patients come out, they talk about their problems, they talk about how they went through from one stage to another. There are doctor networking sites where doctor come out and say that, look, while handling patients, I have these problems. So things have become a lot easier. And maybe going forward, it might have been very difficult at our generations and to go and interview doctors and interview patients and do that shadow working long hours. Today we have that, as well as we have ready web scraping possible, web crawling possible. And I think in the past together we have done some projects where some phenomenal results came out of from this real-time honest answers. So
yeah, and you also written a book on using AI tools for pharma marketing, where I think one chapter is dedicated to scraping reviews, analyzing reviews, getting a pattern. All these, are available today. So we can do that before we do any real doctor or patient immersion. But patient immersion is needed. I don't think you can avoid that. But I think doing data analytics using the web will definitely give you some broad hypothesis to go with. Because health, skin, these are all high involvement categories, right? Where there is a lot of online conversation happening, right? Unlike, let's say, paint as a category, there is not much conversation happening around paint online, right? Except maybe decor. But if you look at health, You look at, there are so many YouTube experts today giving advice on everything under the sun, including diabetes and cholesterol and hypertension and this and that. And consumers are all lapping it up, right?
Absolutely. I mean, that is one of the hot topics everyone wants to talk about, health and finance, and the influencers are doing really a great job there. So, Ambi, this also brings me to the next question that unlike few years or few decades back, where a brand manager or a marketing professional was free relatively to build brands, to do long-term strategies, but things seems to have changed with time. Now we are looking more quarter to quarter. Also, a lot of marketing people, besides salespeople, the marketing professionals have targets to achieve. They are equally responsible. And when they go in the market, whenever I have done some shadow work with them, I realize even the senior most professional actually is trying to kind of sell his or her brand to doctor. Whereas maybe that is an opportunity for someone to listen. But this is very easy said than done. I mean, it's very easy for someone to give advice. No, 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 you should be standing there and listening, observing. How do you think they can strike a balance? Because achieving target is the reality, and the important doctor agreeing to your pitch becomes at times more important than sitting and listening.
So I think it is a challenge across industries. I suppose even in FMCG, every category, marketing today has to deliver some numbers. In some industries, they're very clearly defined that, look, sales will deliver sales numbers, marketing should deliver the perception numbers. So what is the perception of the brand? Is the perception moving up compared to competition? So they're investing in research to track the brand movement against competition, and marketing is measured against that, right? But in pharma, everyone is running around trying to sell the products, and I understand there is a definite pressure. But let's look back. Even if you go back 30, 40 years in pharma, and you've been a pharma brand manager, so there was always a pressure. There was always if your brand doesn't deliver the numbers, it's not only the salespeople are found fault with, right? Marketing people are also told, what is this? Your campaign is not working. The doctor is not prescribing. So why don't you change your promotion? Having said that, I think every marketing manager, or brand manager, while they're spending time on worrying about the short term of the brand, they have to also spend time worrying about the long term of the brand, right? Which means you have to allocate your resources, whether it is 20%, 30%, 40%, to long term thinking of the brand. Long term thinking could be 3 years. 3 years out, what is going to happen? What is the competition? Where is my brand going over 3 years? Therefore, what should I do today? Does it mean today I need to think of a new dosage form? Does it mean I need to think of a new packaging? Does it mean I need to think of a different variant? Do I need to think of a different combination? Right? You have to start thinking about that now, because sales guy is not thinking about it. The sales manager is not thinking of 2 years, 3 years out. That is the job of marketing, right? Which means marketing has to liaise very closely with the medical department to develop, stories. Marketing has to liaise very closely with product development to develop new product ideas, maybe. And you've done that, in the case of, I remember a brand where you say, look, you change the shape of the pill, or change the carton, or change the bottle, right? Stuff like that. That is the job of marketing. I remember when we were launching Gynaton, which is a pretty big tonic brand. It was one of those brands that were lying in the shelf, which was lying there, completely ignored. So we pulled it out, and I think it was, Lalit Bhai, who said that, look, let's think of a very different looking bottle. So we got a very interesting bottle. And then the idea came that why don't we use a different cap? So we ended up talking to our purchase, and purchase was very resistant. We said, we want one of those whiskey caps. A whiskey cap, as you know, is a long cap. Right? So we said, we get a whiskey cap, a long cap, which, goes on top. Now, it took us some months to get that right. But once we got it right, the brand suddenly started looking different, right? So when we went and told the production team that, we want so many bottles for sampling, and then we expect sales to go up like this, they laughed. They said, yeah, this brand has sold probably 10,000 bottles a year. Now you fellows are talking about 1 lakh a month or 50,000 bottles a month. Unnecessarily production mat karo. It will all lie around. Okay, mat karo. So we said, nahi, we are confident this will sell, right? So we promoted it aggressively. I remember we even had a line which I think I had written, how healthy is a healthy child, right? And then goes on to say the child may look healthy but may not be healthy. Therefore, you need to give a vitamin and mineral supplementation. And Gynaton is a very tasty, honey flavored, etc. Vitamin mineral supplement. The brand just took off. I think one of the reasons why it took off, I would claim it's also because of my line, but also because the brand team had spent time designing the bottle, designing the cap. That made a difference. The brand suddenly stood out when you put it on the table of the doctor. In those days, we used to do, at times, we used to do sales sampling. We used to sample the sales pack. So we had sampled 2 bottles and it stood out. And the doctor, loved it. And the product was very good. It was always very good. But it was a marketing team's conviction that this brand will do well. Let's invest in this brand. And then it turned out to be a big brand. I mean, it continued for many, many years, a big brand. I don't know how big it is now, but for almost 10 years, it was running like selling like hotcakes. And that time in Boots, we had 2 brands. One was Betonin, and then Gynaton came, and Gynaton actually became bigger than Betonin. And we had clearly segmented the market. Betonin was seen as an appetite stimulant, and Gynaton was promoted as a nutritional supplement. And it went very well. So Gynaton happened because the marketing team said, we need to develop a brand and we need to go long term. You cannot look at only short term. Right? That kind of thing is also the job of marketing.
Absolutely. And Ambi, what I think which was done very well on both these brands, Canton and Bitonin, is being consistent with the lines that you used. I mean, it is not that 3 month you had a tagline and now the brand manager is bored and the sales guys are a little bored. So you keep changing and you change almost everything about it, which never happened on those brands which stood test of time. So, are there any such tips, maybe for current marketing professionals in pharma, that how does one build how does one build a brand? Are there some do's and don'ts?
You've written about it in your book, The Perfect Pill, that before you jump in, you need to develop your strategy and you need to make sure that what are you saying, what is the positioning, who's the segment, who's the target. And then once it starts working, then don't be in a hurry to change it, right? Because in pharma, unlike television, unlike FMCG, in pharma your medical reps get bored, right? Medical reps get bored with your line. They say, "Arey, 6 months se same thing is happening. Why don't you change it? Kitna time ye padega?" But the point is, moment you change it, the doctor is going to forget your old claim. Right? So it is important for you to stick to it. Just like in FMCG, you keep coming with new campaign, which says the same thing, right? But you tweak it a little bit, whether it is, Lux, which is the film star's secret, or Santur, which is, a younger looking skin. It is the same promise, but you keep tweaking it. So your brand team has to tweak it, but cannot, dramatically change it. So if for example, I think both of us worked on Cobadex CZS, right, which is a brand from GSK. And our research and your research had said that antioxidants are good for diabetic therapy. So we position Cobadex CZS as a adjunct for diabetes, right? And worked. Now, if 2 years later, the brand team says, yeah, diabetes ho gaya, now let us change it. Let us now put heart disease, right? You lost it. You lost it. The brand has lost it. And even now, I think Cobadex CZS is one of the top selling antioxidants, though it is not sold as an antioxidant.
Yeah, absolutely. I mean, there were some of the learnings we had where we had actually sat with the diabetologist and spent hours together to get that kind of insight. So Ambi, you said it so wonderfully that how do you consistently build a brand? But having said that, do you think there is something that pharma industry should learn from consumer over and above what you have already mentioned? And is there something that consumer industry should learn from pharma? Because I'm sure there are a lot of good things that even pharma industry is doing well. So anything that comes to your mind that both can learn from each other?
No, I think pharma industry can definitely learn the process of doing consumer immersions, investing in consumer research from the consumer product industry. I don't think I was on some forum recently, and I did not see the kind of investment which a FMCG company makes in research, consumer research. I don't think pharma industry does. So of course, they do a lot of their own, analysis of retail audit and prescription audit, but they don't do any of their own commissioned research, or I don't think they do enough of it. They can do a lot more, right? For example, in a typical FMCG company, if it is spending 10% of their spending on advertising, they may be spending about a percent or 1.5% on research. Out of that, maybe 0.5% may be going into retail panel and consumer panel, but maybe 0.5% is spent in commissioned research. Like what you said, going in and talking to dermatology, going and talking to patients, going and talking to retailers, right? Using a third-party source. In fact, big market research companies even offer what you said, right, which is scraping the review and analyzing the reviews. They offer those services which can be used. So that is something which pharma industry can definitely learn from FMCG industry. Now, FMCG industry can learn definitely from pharma how to use Salesforce more effectively, right? So the pharma industry has mastered the way of using medical reps, how to train them, how to get them to talk to doctors. The whole idea of detailing is still not practiced well enough in the FMCG industry. Now, today retailers are becoming more and more powerful. So FMCG industry, if they can use their sales reps to actually talk to the retailer, using some of the techniques which pharma industry is used, they will be able to get more mileage from their sales force. So these are two things which they can learn from pharma. Of course, pharma industry does a lot of research in terms of real research, in terms of the effectiveness of various ingredients, etc., etc. Pharma industry doesn't do enough, which I think with the growth of the direct-to-consumer brands, a lot of them are focusing on ingredients, on therapeutics. So someone was recently quoted in an article that very often consumers are not buying cosmetics, they are buying medicines, right? So if you see, at least the very aware consumers today, they look for ingredients, right? They look for ingredients, they look for whether it contains parabens, it contains sulfates, whether it contains this, whether it contains that. So those are things which FMCG industry is not invested enough on. So that is something that they. So that whole skin area is now between pharma and consumer, FMCG. So that's an area where FMCG can learn a lot from pharma.
Absolutely. And Ambi, as you said, like there are so many people, influencers on social media, that there is a gap between a consumer and an expert is a kind of getting bridged, and people know about the ingredients, their effect, their side effects. There are enough people coming and asking, they call and say that Biotin कौन सा brand खरीदूं और कितना लूं, 5,000 microgram लूं या 10,000. These are the questions consumers are asking today. And probably post COVID, we see it more, that gap between a common person and an expert in every field is bridging. So maybe for both pharma as well as consumer health companies have to start realizing this. So Ambi, there's yet another question. A lot of people, young marketers ask me, now, if I have to grow, they always say if they want to climb this ladder, what skills they should have, soft skills, hard skills. And you are a CEO coach. I mean, you understand what it takes to be at that level. What advice would you have for them?
I think everyone wants to grow, right? And everyone wants to kind of grow very, very fast. But you have to realize it takes time, right? So I think the first part of your career is when you need to learn as much as possible. So if you have a job, you're comfortable in your job, it is time to get uncomfortable. So if you are very comfortable doing a particular job, you should go to the boss and say, give me a more difficult job, right? The more the difficulty, the more you will learn. So ideally, in the first 10 years of your career, you should try and move and learn. Maybe you have to spend time in sales, you have to spend time in marketing, spend time in different categories. Don't get stuck in one category, move across categories. And that is what you have to do in the first 10 years. The next 10 years, you have to then start looking at where do you want to kind of plant your flag. And the last 10 years or the last 15 years, then you grow your thing. So as you keep growing, the skills you need will keep changing, right? Initially, you may have to be seen as a very enthusiastic, very hardworking, committed person who's very loyal to the company, loyal to the boss. Then you start getting people reporting to you, right? Then how do you deal with them? What example do you set, right? Are you helping them learn, right? So one is, that, and, I have had a reputation as a very, very tough boss.
I know it very well, Ambi. So you were my boss, but I also know that everyone wanted to work in your team.
Yeah, that is I'm lucky. But, the point is, if you're working under a very nice boss, watch out, right? You have to work under a boss who's demanding, okay? And a boss from whom you can learn. Importantly, whoever you're working with should be a boss who's able to give you time, who's able to sit with you, who's able to correct you, and not tell you what to do. The worst boss is the boss who tells you what to do. The boss has to guide you so that you find your own answers, right? So you have to find a boss. And once you find a boss like that, then you hang on to that boss, right? And then when you become a boss, you have to practice that. So when I coach, CXO level people, some of the things I tell them is, please develop an ability to listen. And someone I was coaching, I even told him that every meeting you sit in, please measure your share of voice. And your share of voice in any meeting cannot be more than 20%. So even if there are only 3 people in the room, you cannot be speaking for more than 20%. Please learn to listen, right? Learn to appreciate the other point of view. I'm coaching someone right now, and one of the points is that he's a brilliant guy. But the point is that his team is scared of saying anything to him because they think he will shoot it down or he will ridicule them. So my whole thing was, you cannot. You have to develop empathy. They don't know enough, which means you can't tell them it's nonsense. You have to tell them, look, are you sure? Guide them. Don't. So these are things you will develop. I mean, I'm saying this, I'm talking about people with 20, 30 years experience. But in the beginning 10 years, you got to look for tough assignments. You got to look for assignments which where you can fail, and you should be ready to fail. You have to put up your hand. I mean, today the brand teams have to say, look, let us try this, sir. Let us try this campaign. Let us try this experiment. It may fail, but it's okay. As long as I am not penalized, I will try it. And the marketing managers have to say, go ahead, try. If you fail, no problem. So if you remember, I mean, one of the things which Anil Kapoor used to tell us is, as far as the team is concerned, the team should be told, the success is yours, the failure is mine, right? The boss has to come from that context. So if you succeed, it's all your credit. If the whole thing fails, I will take the blame, don't worry. So that should be the attitude, right? So you got to plan your career in such a way, you find a boss who is not sugar daddy, who's a tough boss, but from whom you can learn. And then once you learn from that boss, then you try to become a boss like that. Try to become a boss who the team would want to work with. Not because you're the, guy who will, take the team out for a drink every day. No. You are the guy from whom they can learn, who will push them, who will tell them to try new things, who are willing to reject, many, many times. Right? So you have to look for that. You have to plan your career that way.
Absolutely. I think this is a very, very important advice, that you also have to look for a right organization, right culture, right boss. Maybe, I'm just extending, maybe it is not rewarding doing materially so well, but where you're getting to learn, where your seniors are being able to kind of help you learn, fail, and accept that failure is the way forward than just few lakhs here and there. I mean, I have followed this always as as a rule for me, and I totally agree with you. So, Ambi, so going forward from here, and of course, I mean, before I move forward, I remember your entire book, Spring, is about failing and bouncing back, and I highly recommend the audience to read that book because it is all about sticking your neck out, and if at all at times if you fail, just bouncing back from there and having good environment around you which allows and nurtures that kind of culture. So that indeed is a very important piece of advice. So Ambi, if I have to just ask you to say that what are those three trends you are seeing in consumer world, consumer health world? What is that change? Like your career spans over last so many years, and you have always been associated with healthcare brands, either through advertising or through while you're working. Do you see something is changing? Are there top three trends which you are watching that this is what is changing?
I think there are many things changing, right? And we don't know what can happen. Like, for example, one of the trends which we were seeing a few years ago was this entire obsession with nutrition and children nutrition. And as a result, both of us worked on the brand Pediasure, right, which turned out to be a very big success in India as well. But I'm told after the social media campaign against sugar content, etc., the whole category has slowed down, right? Though Pediasure doesn't contain too much sugar, but because the entire attack was on Bonvita, etc., the whole category seems to have slowed down. So we don't know what will happen. But broadly, if you say overall trend is one is increasing health consciousness, right? Increasing awareness of various health remedies, right? So consumers, especially after COVID, are today aware of the problems of different, of dust pollution, etc., etc. So there is a lot of, one is general health consciousness seems to be going up, but that doesn't mean we have become more careful, right? You still see people eating golgappas, pani puris on the road, all that entire fear of washing the hand and all gone away. But today, even among the lower income groups, there is more consciousness that, there is this eye problem I have, or there is this throat problem I have. The good old days where you go and get a water injection may be over. So there's overall health consciousness seems to have gone up. The other is this, we see a kind of a marriage between dermatology, cosmetology, FMCG. So the whole thing about cosmeceuticals is emerging. The whole emphasis on looking good is becoming more and more important, whether it is, hair transplant or Botox injections or all kinds of things. So the whole thing about looking good is again a big trend, whether it is with men. Even young girls used to want to look good. Now even young men want to look good. Multiple products have come up for, even for beard and all sorts of things. So that's another big trend. The third probably is with kids, right? This obsession, because today you have less number of babies, less number of children. So there is a lot of obsession on children. Earlier, I remember for many, many years, we used to work on Bipro Baby Soft, baby range. It never became big, right? Because Johnson was a big gorilla and Wipro was always 5-10%, 20% player. But in the last 5 years, this entire category of baby care products has dramatically grown, right? Look at the way diapers are selling. Look at the way baby soap, baby shampoo, baby this, baby that. Dramatic growth. I think this is because we are now seeing more affluent pockets emerging. Earlier, there was one small 5% who were the affluent people in India, and maybe there was 60-70% middle class, and at the bottom was, the poor. But today, the affluent class has increased, right? I remember when our son was small, we hardly used diapers for him. I mean, diapers were used only when we went out, right? But I remember when, Ruta was having her baby, this is what, 12, 13, 14 years ago, right? 14 or, yeah, probably, yeah, his son is probably 14 years old, right? And she said, look, he's in diaper all the time because I have a bulk order. I order it and every week it comes, right? And the whole bulk comes and so diaper cream, the whole baby area has dramatically increased. So there are several such segments which have grown up, right? Earlier, it was only very few people can afford to put diapers on a baby 24 hours. Today, a lot of people are doing it, right? The number has dramatically increased. And that leads to its own problems in terms of diaper rash, blah, blah, blah. So there are multiple, I can't say one trend, two trend, three trend. I think there are multiple trends happening in India. And let's be clear, it's not one India. There are multiple Indias. Absolutely. There is the low income India, then there is a middle income India, and then there is the affluent India. Each behaves differently. Each will have its own learning curve. Each will have its own way of handling health. And as a pharmaceutical company, you may be addressing the bottom India, you may be addressing the middle India, you may be addressing the top India, right? And you may need to offer different solutions for different Indias. And that's what you need to always be careful about. Same thing applies to doctors, right? Some doctors cater to bottom India, some doctors cater to middle India, some doctors cater to the top India. I mean, there was a particular doctor we spoke to, and for some issue we had with our grandchild, very cool on a call, 10-minute call, and he said 3,000 rupees, right? For a 10-minute telephone call. Obviously, he's catering to the top end, right? So there are multiple segments opening up. So we need to understand what are the segments, what are their, requirements, how can we tailor our products to satisfy them.
Absolutely. And I think, Ambi, as you said, that the whole of India, depending on how you segment it, is also becoming conscious of how they look, etc. But also, I think, doctors sometimes say that patients also want less of side effects. Maybe earlier India was more tolerant India. Today, there is more of this, that you don't want cosmetic related side effects at all, definitely, but even other side effects not wanting. I mean, I remember I used to handle Eptoin, and hirsutism was one of the side effects, and which was okay with the doctors. Today it is almost no, that you can't have facial growth, hair growth or something like that as a side effect. So yeah, very well spotted. I mean, this is something India in certain pockets, of course, is getting more and more aware of. So Ambi, the last question, and that is the question almost everyone keeps asking about, and that is artificial intelligence being used in day-to-day life, in your office work, etc. So I meet different kind of people sometimes. Some bosses say that for my teams, no AI to be used because garbage in, garbage out, and some are very open. They tell us, please come, tell us how to use AI in brand building. What is your take? How is it happening in your opinion, and what should be the way forward for using artificial intelligence?
Now, I think OpenAI is there, whether we like it or not, right? And it's a bit like originally when desktop computers came, it was saying, oh, it's going to take away jobs, it'll make our job mundane, it'll this, that. Same thing is happening now. I think each company has to decide what they want to do with OpenAI tools. A lot can be done. Of course, you also know, and you've written a book on this, you also know a lot of stuff you get from OpenAI is garbage, right? So it could be hallucination, it could be something wrong. So you can't depend on that blindly. But I would say something which may have taken you 1 week, today using OpenAI tools, you can accomplish the same thing in probably 2 days, right? If I want to read a complex article, I can upload it on ChatGPT or one of those other tools. I can ask the tool to give me a summary. I can read the summary and I'm prepared. right? And I can go back and read the full article again if I want. So including that, today, OpenAI can provide so much content for you to use in your marketing communication. So you would be, I would say you're being stupid if you don't use the power of OpenAI. It's a bit like saying, I will not use Excel because it will take away my skills to calculate. But, if you don't use Excel and you have to do let's say a 100 cell by 100 cell calculation, you will be spending the whole life doing it. Excel does it in a minute, right? So you will be stupid not to use OpenAI. So I know some companies which have mandated that every brand team should use OpenAI tools and should also tell. That's important to say, where have I used it? You have to be clear. You cannot hide it from the boss.
Absolutely.
Say that I used it for this. And then it's fine. But you have to show that you've used it, whether it is to analyze data, whether to generate ideas, whether to generate content. Like, for example, if I want, let's say, 20-word interesting quotes on a particular brand, I can upload a 5,000-word document and OpenAI can give me 20 such quotations, right? Very interesting quotation. No, I'll be a fool not to use that. So you have to embrace OpenAI. You have to start using it. Don't become a slave to it. Don't become a prey to it, but keep it under your control and use it well, is what I would say.
Absolutely. And maybe nowadays this talk of 90 hours a week discussion is happening. Maybe with OpenAI and such tools will actually make you not really slog that long. One doesn't know, or maybe it will just improve your efficiency. So maybe I take this advice. It's absolutely important that use wherever you can, but flag it every time that you have used it, and only improve the effectiveness of your work instead of just doing routine, mundane kind of work manually. So thank you, Ambi. Thank you so much. I'm sure there are so many other topics which I would like to discuss with you going forward, maybe once again. But in this episode, we have understood how it is important for any pharma marketer to decide on what are the important things, how do you actually do inciting, what skills to develop, what to look out in a job, and how to grow continuously by probably at times taking tough work on. So thank you, Ambi. Thank you for your time. It was indeed my pleasure to have you here.
Yeah, so thank you, Gauri, for inviting me onto your podcast, and I wish the podcast all the very success, and thank you for listening. Thank you.
Thank you, Ambi. Thank you so much.